Good afternoon and welcome to the Hamilton Reopens media availability for this Friday, July the 3rd. Before I jump into the COVID-19 updates, I just want to remind citizens that we're asking you to limit your outdoor water usage in all parts of Hamilton until Monday, July the 13th. Residents are asked to voluntarily avoid non-essential outdoor water use, such as watering lawns or sprinklers or filling large pools. At this time, the restriction is a precautionary measure to protect the water supply in Hamilton, and where possible, the city will reduce its own irrigation activities in flower islands and sports fields and golf courses. However, due to the heat, municipal spray pads will continue to operate. So if you could ratchet down your water usage and to protect our resource, that would be very, very helpful. Thank you. On the announcement side, on the federal side, next Wednesday, the Minister of Finance, Bill Morneau, will provide an economic and fiscal snapshot update. This update will provide a picture of where the Canadian economy is right now and how its response compares to other countries and what we can expect looking into the future. Back in May, the federal government announced a one-time boost of $300 to old age security benefits and a one-time boost of $200 to the guaranteed income supplement. These one-time increases to old age security and guaranteed income supplements will come into effect starting next week. Provincially, the province announced $150 million for the Social Services Relief Fund. This fund is designed to help protect the health and safety of the province's most vulnerable people. Funding is providing municipalities and organizations that administer social services such as shelters, food banks, emergency services, charities and not-profits that continue to deliver their critical services, hire additional staff, and maintain all appropriate public health guidelines at their facilities. So much needed and well used resources. The government will distribute the additional funding among the province's municipalities who will deliver the funding to local service providers and to ensure that the local clients are receiving the supports they need. This brings the total investment into the Social Service Relief Fund to $350 million. Today, the province also announced a launch of an online training program to promote safe workplaces. $3 million investment will provide free online health and safety training for job seekers and those who need essential qualifications to perform their job responsibilities. Up to 100,000 job seekers can now take free online workplace health and safety training through Employment Ontario. There are 10 courses available, which include topics such as infection control, conducting health and safety incident investigations, and preventing workplace violence and harassment, to name but a few. So for those that are interested, contact your local Employment Ontario service provider to enroll in that program. In terms of the city updates, the provincial funding to help municipalities and urban Indigenous community partners fund housing solutions needed as a result of the COVID-19 outbreak. As I mentioned earlier, the Ontario government announced this week that it will be providing additional funding to help municipalities and urban Indigenous community partners fund long-term innovative housing solutions resulting from the COVID-19 outbreak. That funding can be used to renovate shelters or purchase new facilities that will help with physical distancing in the short term and support longer-term, more sustainable solutions to homelessness. In addition, this funding could also be used to provide vulnerable people with food, shelter, and supplies. And Paul will be sharing some more information on that shortly. Also, a new and amended emergency order to expand restaurant patios faster. The province announced today that it will be issuing a new emergency order and amending another under the Emergency Management and Civil Protection Act, which will allow municipalities to quickly pass temporary bylaws for the creation and extension of patios and allow covered outdoor dining areas to serve customers. So Hamilton had already acted very quickly to support our local restaurants to open patios almost 2 months ago on May 13th. Hamilton became one of the first cities in Canada to temporarily permit outdoor dining on streets, sidewalks, and parking areas on public and private lands through the approval of a motion allowing the creation of temporary outdoor dining districts and temporary outdoor patios. Since that time, the city's program has already approved 68 outdoor dining districts and provided temporary outdoor patios right across our city. Earlier this week, Councillors Marul and Farr advised Council they were bringing forward a motion that would extend this program even further to permit patios for even more of the city's restaurants. And I've already called a special council meeting for this coming Tuesday next week so that we can prove this motion and have it considered quickly. The province's announcement today will helpfully be in support of the actions already taken and underway in the city to support our restaurants. Update on our waterfalls. They're all of the associated parking lots across the city, with the exception of Tews, Webster's, and Dundas Peak, will be open to the public starting July the 15th. Let me say that again. All waterfalls and their associated parking lots across the city, excepting Tews, Webster's, and Dundas Peak, will reopen on July the 15th. As a COVID-19 has restricted the use of the shuttle services that have been popular and necessary, and these three areas will remain closed at this time. Also good news, Hamilton Public Library is opening 6 more branches for takeout service. Those branches are Ancaster, Kenilworth, Sherwood, Saltfleet, Turner Park, and Waterdown, in addition to what's already been opened, which is the Central Libraries at the Dundas, Terryberry, and the Red Hill that opened a couple of weeks ago. So when your holds are ready, the library will email or call you, and you can make an appointment to pick up your holds starting at www.hpl.ca/takeout or by calling 905-546-3200. And those pickup dates begin on July the 14th. As to masks on transit, just a reminder that on June the 22nd, it became mandatory to wear a non-medical mask on public transit in Hamilton. As we've now returned to resuming collecting fares and having our customers board the bus from the front door, we will be distributing non-medical masks to customers who need them starting next week. And Paul Johnson will remind you about those details again in a moment. So please, if you're going to be riding the HSR or DARTs, or you're able, please wear a mask. We know this is an extra step that can help protect others in spaces where physical distancing can be hard to maintain. However, those with COPD or breathing problems or other reasons why they can't wear a mask will not be required to do so, as well as children under 2. Beyond that, we're requiring mandatory masking for everyone else using the service, and I'm sure it'll be a comfort level for most people that can't physically distance, that that level of protection is in place in our transit system. I'm going to pass it on to Paul Johnson now, our EOC manager, to give us any additional city updates. Paul?
Thanks very much, Mr. Mayor. I want to start off with some program updates and really, again, congratulate our staff and our community partners for the work they're doing to reopen some critical services in Hamilton. Last week, I had mentioned that about 26 childcare centers had reopened. I'm pleased to say that by July the 13th, we expect that number to grow to 90 childcare centers open. So within the next week, we've got a lot of activity happening, a lot of centers opening up. And as we hit the middle part of July, we'll be up to 90 childcare centers. And just a reminder that while we have well over 200 different childcare centers from September to June, across the summertime, traditionally we only have about 130 programs going. So that means by June the 13th, we'll have about 70% of childcare centers open. And the trends that we're seeing are that those childcare centers are operating at about 50% capacity, and that has to do with the cohorts of children and staff that are required within the guidelines. So we know that for many families, all the childcare options they experienced in the past are not available. This is an opportunity really to see how childcare can reopen safely, and a huge question and a huge piece of work that's happening provincially is to figure out how we will increase that capacity of childcare heading more towards the fall. Certainly, all our childcare centers that operate through a variety of partners, including our own childcare center, which did open as well, the Red Hill Family Center. They're reaching out to families, confirming their interest in coming into those childcare spaces, and many are taking us up on that opportunity. You would have seen in the press some information about our Home for the Holidays program that renovated social housing units and allowed for a large number of people to get into housing starting late last fall and then into the new year. I also received this morning some late-breaking information about the first quarter of our work in housing around the Canada-Ontario Housing Benefit, which provides a portable housing benefit to assist families in need with rent. So for the period between April and June, during the height of the pandemic crisis, 101 households were housed, and many of them were experiencing homelessness. It was the second highest level of activity amongst our comparative municipalities, and just a tremendous job by our staff who didn't let COVID-19 and all that was going on stop them from the core job that they're doing, many of our folks in housing, of helping people to find permanent affordable housing. That has certainly helped us through this pandemic. The best route is to get people into their own home and into an affordable permanent housing unit. And it's just another great example of the work that we're doing to make that happen. As the mayor mentioned, mandatory masking is now in place on HSR. At our customer service counter at 36 Hunter Street, which is known affectionately as the Hunter Street GO Station, we're open for business there for people to come and do all of their the work that they need to do, as well as a place where they can come to get a free non-medical face covering for our customers. These are one-time use. They're really meant for those that haven't had a chance yet to get out and get their own mask or make their own mask. And this will allow them to safely participate in transit, meet our mandate of wearing a non-medical mask on transit. And so check into the folks at the Hunter Street GO Station. We are also working with some social housing, some social agencies, social organizations in the community to hand out supplies of masks for those who can't afford it. And DARTS is going to be working also with folks to ensure that their users can have access to masks. But for the general public, the Hunter Street GO Station is the place to go if you need a single-use mask so you can access transit. Really happy with this next announcement is that a number of our pools will be opening on July the 6th, which is Monday. We've been working very hard to make that happen, and really thrilled that 9 of our pools and 1 waiting pool will open as of July the 6th. Generally, they're operating from 12 to 7 p.m. daily until September. There will be reduced capacity, and sometimes you will have to line up for use of the pool, but that's all so that we can conform with the guidelines that have been provided for pool reopenings. All of the schedules are online, so folks can go to hamilton.ca/recreation and look at a variety of things about recreation in the city of Hamilton, including our rec at home programs and our rec in the park and all sorts of things that are going on this summer. But of importance, I think right now, given this heat wave that we're in, check out what pools are open. And there's a number of them. Indoor pools that include Brewster Pool, Huntington Park, Jimmy Thompson, Ryerson, St. Winston Churchill, Stony Creek, and Westmount. Our outdoor pools at Ancaster Lions and Coronation, and then the wading pool at the Dundas Driving Park. And then the following week, there are a number of predominantly outdoor pools, I think, that are opening as well. So by the end of the week of the 13th, the 14 pools that we committed to will be opening. And congratulations to our staff who have done a whole bunch of training in a very short period of time to make sure that we can do what we need to do to keep everybody safe and allow people to enjoy these great amenities. We are really, really thrilled with the provincial announcement that the mayor shared with you today around more money for social programs, and in particularly shelters and food, those types of things. We're actually bringing a report forward, our department, around some more investments we need to make shelters safe, to ensure that we keep up physical distancing, to ensure that we allow the isolation of people if they are experiencing homelessness and they are testing positive for COVID-19. We're going to need this for a while, and this type of investment will allow us to ensure that that happens without adding an additional burden to the property taxpayer in this community. So we're really excited about that. One little piece before I get to my final update is that some of you will have noticed that we are updating the bylaw enforcement numbers now on a weekly basis. That'll happen on Monday mornings on the city's website. Individual requests, particularly from the media or other partners who need it, we'll turn those around as best we can if you need information for some purpose midweek. But this is an ongoing trend, and you saw it a bit in the public health information that's coming out as well. We are settling in now for this happening for a long period of time, and particularly in terms of bylaw enforcement, the number of charges is dropping significantly. So the change is not very significant on a regular basis, but this by no means that we are not out there enforcing what we need to do. So a number of you have joked a number of weeks ago, I threw out a phrase that's making a comeback. So call this Throwback Friday if you like, but I do need to say knock it off again. And I hoped I was out of that mode. We did it very early on in some of the work here, but I do need to say again, knock it off. And this is particularly to those who are taking down the caution tape and signage on our playground structures in parks. The playgrounds and play structures are closed. They have signs on them that say they are closed. It's been hard to keep the tape up even because of the weather. Not always is it people taking it down. The weather just, plays havoc with the tape. But we are getting increased reports that people themselves are actually removing the signs. And that's very dangerous because those signs alert people who may not have heard the news or may not know what's open or closed, that they are indeed closed. And if there's no tape and no signs, then confusion will reign. So please, they will open when it's safe to do so. And with note, a couple of days ago, the Minister of Health herself talked about the fact that they're very aware people would like these playground structures to be open, but they're still working through how that can be done safely, given the fact that it's really impossible to regularly sanitize or clean these structures. So you don't want to end on a negative, I suppose, but I do want to leave that word with people that playground structures remain closed. Please do not tamper with the signage and the tape if it's still up. We need people to realize that these aren't available. We would really hate for young people in our community and their families to use them unwittingly and have anyone get sick. So with that, I'll turn it over to Dr. Richardson.
Thanks, Paul. Good to hear you have the phrase come back. And yes, absolutely. We want people to remain safe in the community. Well, there are still things with this new virus that we're going to continue to try to understand and put in place the best control measures that we can. And those are going to change from time to time as we get new evidence. But the piece around play structures, we do indeed want everybody to be safe and to be able to follow along the guidance that's going on. So important information to share. From a case count perspective, we're at 843 cases today. That's just one new case from yesterday, which is good. We're continuing to see just about 3 to 4 cases per day on average. We may have a higher day, but then the numbers come right down again like they have today. So 89% of the cases that we have had are resolved as well, which is also good news. And we have had no new deaths. We don't have any institutional outbreaks or community outbreaks. So again, we continue to do well. Hamilton continues to follow the control measures, and that's what we want to see. We want to see that those control measures stay in place. So as we open things back up and we are following that public health guidance, the guidance around wearing a mask if you're on transit or in an indoor public place, wearing a mask if you're outdoors and unable to physically distance, continuing to wash your hands regularly, not touch your eyes, nose, mouth, to make sure that you are using hand sanitizer if you can't get to hand washing on a regular basis, and of course, staying home if you're sick. So very important we continue to follow those, and it does look like that continues on, which is great. I do just want to make a note about Hamilton testing levels. So as we've been talking about, we do about 400 tests every day through the 3 testing centers that are available to us. And to date, since we started COVID-19 testing through these centers, we've done over 42,000 tests through our partners at Hamilton Health Sciences, St. Joseph's Hospital Hamilton, and through our primary care providers, which is just tremendous. And we are encouraging people to continue to book appointments to be tested at one of the 3 testing centers. We do know that there's some frustration because it's very difficult for us to keep up with the volume of testing that is required for people who are visiting long-term care and retirement homes. And we have great empathy for that. We are working to put forward proposals to further expand testing capacity and looking to the government as well to provide us some policy on what they want to see around assessment centers as we go forward. On the results front, though, another piece just to clarify, we do not get results for anybody who is negative. We only get results that are positive. So that's because we in public health do have a role to play when it comes to following up those positive results, working with people, doing what we call case management and contact management. So working with people to understand what the result means, to make sure that they're able to isolate while they're off, make sure if they have any challenges like accessibility to food, suitable housing, all those sorts of things, that those get resolved. We check in on them regularly by phone to make sure that everything's okay and that they're continuing to be able to cope. And similarly, we follow up wherever it is they might have gotten the infection from, and who might have been exposed to them while they were sick. And so that is our primary role when it comes to these. When it comes to people's negative results, they really need to go back either to the clinician who has done that test, wherever that may have been, or they can go back to their doctor, or the most important site is that provincial portal to get the results. We know there are some delays in getting the results onto the portal. And we don't have any control over that piece. If you give us a call and give us permission, and we were to try and access those results on your behalf, we wouldn't have anything different than you would have. So there's really no added role that we can play for you in getting those results, and it just takes that length of time for them to get up there. We do know that people are at times waiting up to 10 days. We agree with you. There's a challenge around this. We know the province is working on that. We're trying to look and see if there's different ways that we can access them, but we have no ability to do that right now. So unfortunately, that's where we're at. We know it's frustrating. We're frustrated along with you. And that is why you'll see on our call queue and whatnot, there's been some changes there, because there's just to let people know that there's nothing more that we can do in terms of helping people get those results at this point. So that's about it. I guess it's also a bit of a downer Friday. It sounds like, Paul, with you and I at the end saying, we aren't able to do these things, but I do want to just emphasize again, our case numbers look good. We are, continuing to move forward, and as people are out and about in the sunshine and enjoying things as they slowly open back up, we do want people to continue to stay safe. Over to you, Mr. Mayor.
Great, thank you. And let me lift it up a little bit then. So I want to do a shout out to Janet Rogers, a Mohawk Tuscarora writer who lives on the Six Nations Reserve. During this pandemic, she is serving as the Mabel Pugh Taylor Writer in Electronic Residence for both McMaster University and the Hamilton Public Library. So Janet started a podcast called Writing Home that features the stories of Hamilton writers. Two of those episodes have been produced so far, and the first on the theme of meaning of home, and the second on how writers are experiencing this pandemic. Janet has also invited submissions by community members and including their thoughts about home and pandemic as well. So the podcast now includes more than 50 poems, essays, and other forms of storytelling. Both the episodes are now available. This wonderful effort is proof that pandemic is inspiring for writers, and we need inspired writing more than ever in these challenging times. So congratulations to Janet Rogers for this innovative approach to her role as a writer in residence. Well done, Janet. Thank you. And advancements in virtual medical clinics. Shout out goes to St. Joseph's Healthcare Hamilton and Chief of Surgery, Dr. Anthony Adili, for their major inroads into virtual medical appointments for patients. During the COVID-19, the hospital was forced to adopt different ways of delivering care to patients in need while maintaining a physical distance. Now, this is where a virtual medical appointment has filled the gap. Before the pandemic, the hospital would conduct approximately 4,000 to 5,000 virtual clinics a year. To date this year, Dr. Dilly estimates that the hospital has done close to 20,000 virtual clinics. These virtual visits, either over the phone or via video conferencing, have made it much easier for people to connect with their physician and to help avoid backlogs at the hospital during a time of critical need. So while in-person appointments aren't going away anytime soon, the increased capacity for virtual appointments creates a new option for people to follow up with their doctor without having to attend the office. So congratulations to St. Joseph's Healthcare Hamilton for your steadfast commitment to our patients and to seeing us through this continuous improvement. And I know my doctor's office is doing virtual sessions as well, and that's a good thing. And I'm sure more of that will happen in all kinds of work environments as well. But moving from 4,000 to 5,000 to 20,000 is a giant leap forward, and obviously serves that many more people. So congratulations, Dr. Adili and St. Joseph's Healthcare. As well, we continue to thank our frontline and essential workers, our nurses, nursing home staff, the cleaners, grocery store workers, truckers, and everyone else who's going above and beyond during this pandemic. We thank you and appreciate everything you're doing out there. Turn it over to Jasmine now for media questions. Jasmine?
Thank you, Mr. Mayor. We'll start with one question and one follow-up for each of our media partners. First up is Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you. I hope everyone is well today. Happy Friday. My question is for Dr. Elizabeth Richardson. My question is about the race-based and socioeconomic-based data collection. I've been told that it will take at least until September until we actually see this data, and I'm just wondering why it will take until then to get the data out when it seems as though more and more specific categorized data is coming out regarding COVID-19.
Sure. Thanks, Bobby. I appreciate the question. And I asked that question myself this morning, actually, when I was talking to my colleagues about this very issue. And just we were talking about the timing of when we would be able to get a report back on this. And the challenge is that, absolutely, this is information that people are being asked to provide. It's delicate information. It's really a new thing for us to go ahead and collect data of this sort and for it to be really welcomed in terms of doing that kind of data collection. And so we are finding that some people are more comfortable answering one or another of the questions. And so for any given question, our response rate isn't always that high. And so in terms of getting numbers that are meaningful for us to do data analysis with, it's taking some time. And of course, that also relates to the fact that the number of cases that we have now is lower as we go forward. So we're very much looking at those numbers and looking at when it is that we'll have enough that we could do anything and say anything that's really meaningful in terms of having enough data to make comment on. And that's when we are planning to come forward with a report to the Board of Health in September. So that report would be online a little earlier at the beginning of September, but that's when it would be done. The analysis, of course, will be going on in August to get it there. We're considering the issue of whether or not we go back, and we've had further discussions with Public Health Ontario about looking backward at the data, and we are going to need to get some ethics advice on that because it's not managing the cases, and the changes that the ministry did put in place only are for going forward. And so we will be having some further discussions around that and some clarification around that piece as well.
Thank you. I appreciate that. I just also wonder, oh man. I also wonder about, I heard there is like not a task force, but let me find there's like a board that is helping, I guess, navigate how you go about collecting this data. But I just wonder, like, why is there a report for this when you can't just upload them the same as the stats on gender and age, for example? Is that like a recommendation from this board of the Equity Data Community Advisory Group?
Thanks, Bobby. There is a group that reached out to us that offered to provide us with some consultation and advice based out of McMaster University and some community members. And so we've had some discussions, just one or two discussions with them about advice that they may have. We're also considering, of course, within the broader advisory committee work that's going on by the city itself and looking at how to position it and get advice from a broader range of people. So that is all part of the discussion that's going on with putting together the report. The issue around this data is even with age and gender, then those things are more specific to a specific case. But when we're looking at this issue of what's happening and where are the trends occurring, we really want to see more numbers in terms of that piece rather than a case by case sort of piece. And because those numbers are small, as you've heard me say, those numbers we don't have the numbers behind them to really draw anything meaningful in terms of conclusions or advice that we can take from them. So we're still working all those things through. I know it can be a bit frustrating. It seems to take a bit of time, and it is taking some time. And we'll continue to do the best we can with that.
Thanks, Dr. Richardson. Next question will be to Joey Coleman from the Public Record. Joey, you can go ahead.
Yes, so my question to Paul Johnson is I saw a jump in the number of social distancing tickets issued in the last update. Also, since you're not, we would like to know how many fireworks discharge tickets were issued this week.
Short answer is I don't have those specifics. We'll follow up with you, Joey, and get you a breakdown of those.
So you're telling me that, obviously the public and everybody's been asking since Canada Day how many fireworks discharge tickets there's been issued, and that has not been internally discussed at the Emergency Operations Center to determine resources, trends, that type of thing?
So no, if it didn't hit the desk, it probably wasn't that big a deal. And the other piece is that that is now going to expire, I think, as of the 4th. So the fireworks was a temporary ban on that, and we've gone through that now. So in terms of looking forward, that that is now lifted, or lifted as of the 4th, I believe, is what we put within that bylaw. But we'll get you the numbers in terms of what it was. But no, it didn't come to our table this morning.
Great, thank you, Paul. Next question to Matt Ingram from CHCH. Matt, you can go ahead.
Oh, thanks so much for taking my question. My question is actually for the mayor. I was wondering, on Tuesday, you said that a bylaw is going to be coming before council in the near future regarding mandatory masks. I was wondering if you had any update on that, if you know when exactly it's going to be brought before council and what stage you're at in crafting that bylaw.
Okay, thank you. I'll also turn it over to Dr. Richardson to comment on that. Obviously, we're waiting for a recommendation from her and her team in terms of how that mandatory masking will take place and where it will apply. And I anticipate that something will come to the July, I think it's the 17th council meeting. So sometime prior to that, we'll have a final determination from Dr. Elizabeth. And as we've done in the past, we're adhering to public health recommendations, and that is absolutely the right thing to do. And I know that Dr. Richardson and her team are currently looking at that. I know others have put some bylaws in place, and they've put some restrictions and exemptions in place as well. And I know that Dr. Richardson and her team are looking at that right now. Dr. Elizabeth, do you want to address that?
Absolutely, Mr. Mayor. Thank you. Absolutely, we're looking at the issue, and as the mayor said, it's playing out in different ways in different parts of the province right now, in part related to the epidemiology of the cases that they're having. So if you look at Kingston, for example, they've had a large outbreak associated with people not wearing masks in a personal services setting. And so they have gone ahead with an order there to require masks. And there have been some changes in the initial steps that have been taken in various areas around what to do around mandatory masking. So we're following those along. We'll bring some advice to the Board of Health when it meets on July the 10th. And as the mayor said, look to having something in time for council on the 17th.
Might I also add, so we've had lots of people comment on the issue into our office, and I would say, I think there might have been about 100 people, commenting for and against, 72% in favor of some sort of masking in public spaces or in indoor spaces when physical distancing can't be done. So I think there's broad community support for this, but we'll hear more, and I think we'll hear what the doctor and her team actually put on the table. And I think the bylaw approach is definitely the approach that we're heading towards in terms of if and when we do this.
Thank you so much. And my follow-up would be actually for Paul in terms of enforcing such a mask bylaw. I'm just wondering, would that be something more simple to enforce simply because bylaw officers can see if people are wearing masks or not?
So I suppose at the level of that, yes, it's a yes or no. If you're in a space where it's mandated that you wear a mask and you're not wearing one, then the question becomes: is there a reason? Because there are exceptions, and that's the same on transit as it would be in any other case. The jurisdictions that have already implemented this generally have headed in a direction, whereas that there is a penalty, and it's an awful lot like the other penalties that we have along this way. If you look at from when we instituted, for instance, our physical distancing bylaw in early April, to now, relatively speaking, very few charges, given the fact that people are interacting all over the place, each and every day. So one is people are generally following the rules. And then the second piece is this is about education. This is about encouragement to make things right. And it is about having a tool at the end of the day, should there be an egregious example of simply not following this. And should council wish to go forward with mandatory masking, then it would be the same. It would be the same approach. I've been fairly consistent to say we are not going out to hire a whole bunch of new bylaw officers to enforce this. This will be part of a suite of things that we enforce through our folks that handle all number of bylaws, including those that have been added during this pandemic. And so it would be used in a situation where there is, as I say, some egregious example of people choosing to really just not understand the education of it, just unwilling to accept that. That's been the way we've been using it in all sorts of circumstances. The physical distancing bylaw is the best one I can point to that was city-led, but also our charges that we've been laying under the provincial orders are the same. We don't go around trying to catch people out. It's when there's it's pretty obvious examples of knowing something is closed, of walking by several things that say it's closed and still choosing to use it. We're at a point now where we have very little tolerance for that. And again, with masking, it would be the same type of period of education and building a support for that. And I can just tell you that if people are going to be expecting that they can call in and somebody will arrive within 3 or 4 or 5 minutes, that's not how this happens. These are not emergency calls. As we've said with all bylaws, if this was to go into force, it's not a 911 call at all. This is something that if we can do something about it, we would, but it's not going to be an instantaneous response. And I think the public we need to work together in order to make sure that we're asking people to wear masks. But the other side I would say to that is if somebody says they cannot wear a mask, this isn't an exercise in trying to call them out and put them on the spot about why not. Because for those who can't wear masks, it's often because of a medical condition. And like you, I don't really want to walk around disclosing medical information or personal information about myself, and nor should that be an expectation. So we have to balance asking people to step back if they're a little too close, or asking people, do you have a mask? Could you wear a mask? Those types of things. And then we need not to be our own cops and trying to really call people out on this. And that's, for me, a bit of the challenge in all these things is how do we not overly stigmatize people and actually have people not want to come out and be in public. This is about helping to stop the spread. Full stop. This isn't about some exercise in catching people out. It's not about trying to stigmatize people. It would be an additional tool as we reopen more facilities, and it's really about those indoor facilities as we open more of them. Could this be a helpful tool? That's what will be placed before council and for their decision making.
If I can just add to that, if you wouldn't mind, Paul, because that's so very well said. This is about reminding people that COVID-19 is out there and that they do need to take some precautions. And we do, from what we have seen, and this is still an area where there's limited evidence. As I said at the beginning, this is an area where we're getting to understand more as we go, but it's by no means definitive. And what we are seeing from those countries that have adopted this is that where you can get that mask wearing level up into the 70-80%, that really can make a difference in decreasing the amount of transmission. And the less that we have out there, the less likely it is to spread, which is all just rolling forwards in a very positive direction. And by and large, this has been very effective through an educational response. And that piece about some people just cannot wear masks for various reasons is so very important. So I think we have to keep our sights on that. Paul's been great about saying that all the way through. And what we're trying to do is really, help people to do the right thing rather than trying to make sure every last person is wearing a mask.
Thanks, Dr. Richardson. Next question to Kate McCullough from the Hamilton Spectator. Kate, you can go ahead.
Hi, everyone. Good afternoon. My question is for Paul Johnson. I'm wondering if you have a timeline on when other waterfalls might open and whether or not physical distancing is possible on the shuttles.
So to reiterate the mayor's comments, we're looking at a number of the waterfalls. There's a few exceptions, the waterfalls where because the shuttle services can't run because of the issues around how much space there'd have to be on the buses. So there are a few that won't open, but by July 15th, a number of the waterfalls, the parking lots that are attached to them will be available for the public. Will there be some cases where pathways and other places are fairly narrow? Yes, but that probably exists in a number of cases today. And really what people will see is they will see very prominent signing that indicates the same things we've been talking about for quite some time. And that is that you're to try and maintain that physical distancing as best as you can. And the other piece is to recognize, Dr. Richardson shared this a number of times, Dr. Harvey has as well, and I've shared it after listening to them, is that the simple act of walking by somebody is a very low risk activity in terms of even if it's within that 2-meter bubble. And so there may be times where people are passing each other in a variety of settings within that 2 meters. And that, though, you know, you can never say anything is risk-free. It is a very low-risk activity. So talking to the Hamilton Conservation Authority, understanding that we can't keep these things closed forever. They are outdoor activities, and they do allow, in general terms, for a lot of spreading out. That's what we're after. My advice is always the same to folks. If you go somewhere and you're a little concerned with how many people are there, then come back another time, go somewhere else. And I understand that that's a bit of a pain if you've decided to go somewhere, but you know, those are the kinds of things you can do to keep you safe. But it is our goal to get many of those waterfalls up and going by July the 15th, which I think is a great news story and one that we've been thinking about for a while, and happy to see that. So that means most of the outdoor amenities would be available to people in this community. And obviously, as we know, people that travel from other communities to come into Hamilton as well.
Okay, thanks very much. My second question is about the playground signs. And do you know or have a sense of why people are tearing them down? Is it out of frustration? Are they confused and they think playgrounds have reopened? Do you have a sense?
So I don't know is the short answer, but I would sense it's more out of frustration than anything else. I can't imagine people, you know, just by saying I don't know what the rule is, so I'll tear down a sign that tells me what the rule is. I'm pretty sure that might not be the case. We have seen this before with the frustration. People want to use amenities. We saw it with the stairs when they were closed and closed longer than some other outdoor amenities. Well, again, we worked with public health to really make sure that we could set in place some guidelines for folks to use that. And then we opened them. The difference with playgrounds is that this is across the entire province. These are not amenities that the city, like our stairs, was looking at because they're maybe not unique to the city of Hamilton, but not every community absolutely has escarpment stairs. So those were a little bit our issue to deal with and work through. These are coming across the province. I think it's a frustration. I think you see people at some point saying, I just want to get back to using the things that I use. My kids have loved those for years. I enjoy getting there together and seeing other families and what have you. I get all of that. But the bottom line is they are closed by provincial order. They remain closed by provincial order. And I think that, you know, that is not because somebody's forgotten about them. When you have the Minister of Health herself commenting on the fact that, yes, they're still looking at that. And yes, they want to reopen those when it's safe to do so. That means it hasn't been forgotten. It means that we just have to wait a little bit longer. So I just encourage people to, there should be no reason to remove a sign in any place. That's not the role of individuals in neighborhoods. That's the role for us to do when the time is right. And believe you me, the minute we get the notification, this won't be something we take weeks to figure out. This will be as soon as we can, we'll take those signs down and get kids back playing on those play structures as soon as it's safe to be.
Thanks, Paul. Next question to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Thanks. This question is for Dr. Richardson. You mentioned, I believe, that public health is looking at different ways of getting results, testing result numbers to be able to get them out to people faster. Is that correct? And if so, what specifically would you be looking at?
So just want to come back and say, we are not the ones who would get the results out to people. That's not a public health role in this. That's really the role of the portal in terms of providing results to people, or the clinician who has ordered that test. So the reason we would be doing it is that to help those people who aren't able to access the portal, that then we would have access so that we could help them out. So it's not at all a piece of us getting results out faster to people. That is other people's responsibility in the health system. We don't do the testing. We don't provide the results on testing. We follow up on people who are positive, and we help out with booking the assessment centers. So we're just looking at getting that that access. It does help us in our other work as well, and it's just part of the upgrades in information technology that is going on within the health system more broadly.
Katrina, did you want a follow-up question?
Yes, please.
Go ahead.
Sorry, I might have remuted myself. In terms of the, you mentioned that that public health knows there have been delays for getting information onto the portal. What do you know about that?
We don't have a lot of information on that piece. We just hear from people who call in who are frustrated with getting their information. We know for our positive results, they will be prioritized in terms of having those tests done and getting them. They still do get faxed through to us, so we do know what the turnaround time is like for those results. And then we have raised the issue with our provincial partners when we're talking with them and in discussing with other colleagues. We know other people are having delays as well, and that centrally they're working on how do they, continue to improve the speed of uploading results, making sure that all the labs that are participating in the laboratory network are doing those things. So we just have a high level sort of 20,000 foot overview of the issue, but the details are more properly found with Ontario Health and with the labs themselves.
Thank you, Dr. Richardson. Next question to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. The first one I wanted to ask is for Dr. Richardson or Paul Johnson, whoever is most appropriate. As you know, we've now been in stage 2 for a couple of weeks now. Is there any, problem areas that you're noticing or anything, have you looked at any info out of stage 2 yet? Is it going well? Like, can you give us an idea of what you're learning as, we've been in stage 2 for a couple of weeks now?
Paul, do you want to lead that one off?
So I'll start from a general community perspective, and then Dr. Richardson could talk about the cases, which I think is another piece of this as well. Certainly, we're seeing people, still respecting the rules. We're seeing more things happening. I've been around to see a few of the patios, not in any, official way. I've just been walking by and seeing how patios are functioning. I've got several large patios actually quite near to where I live. So on my daily walks, I've been checking it out, and I've been really impressed with how both the proprietors of businesses and the patrons who are going there are adhering to the rules of that. So I think that that's a good news piece. That's an early start piece of what happened in stage 2, is that ability to get outside and eat, and that will help because, of course, in stage 3 there could be indoor dining that happens sooner rather than later if the province moves towards stage 3. So I think learning from the stage 2 and patios will help us in that stage. The other piece is I would just say that as the stages move on, things get a little bit longer in terms of it's not opening up something. So taking down a sign and opening it up, there's a lot more training and things that have to go on. So as I reflect on childcare centers, as I reflect on the work that's happening to reopen recreation programs, when I look at the work that's happening to get kids out onto the sports fields to do their training, it's not a flick the switch on piece. There's work that has to be done to get public health inspections. There's work that has to be done to get provincial bodies to sign off on the plans in the case of sports. And it's all taking a little bit longer. So I would expect that that's the rhythm that we're in. So the community is, I understand, very, very interested in getting back to normal things, getting summer camps up and going, day camps, getting people back out onto soccer pitches or baseball diamonds and doing that work, and getting kids into childcare, because for many families that's been a challenge for a long time. And so what we are seeing is the frustration that these things take time. And the response to that is, of course, they're taking time because of the very strict requirements that people need to follow. And that is what will help us to be safe. So when I see our childcare centers operating well, when I see, us taking a good hard look at how many kids will be allowed to train on a particular field, when I see the work that's happening in getting our pools up and going and things like that, that lets me know that people are taking it seriously. seriously. And I think that's the other side of this, is the seriousness that people are taking it is borne out in the way it's things are continuing to operate in this city. So operationally, I think the community is handling stage 2 well. And what we learn in this stage 2 will help us as stage 3 opens yet more things and more of those other amenities in our community. So really pleased to see how people are taking this to heart as they realize that, yes, it's about getting back to business. Yes, it's about getting people back to some of the things they do, but it is first and foremost about how we do those things safely. And then ultimately, the result is in cases and things along those lines. And maybe Dr. Richardson can add just a couple things about what she's seeing and any trends in that.
Yeah, sure. Absolutely, Paul. I think, that's definitely part of it for us, is to continue to monitor those cases, look at the impacts in terms of the health system and where it's sitting at in case we do get an uptick of cases in this phase, and have to increase the amount of hospital usage, or unfortunately the ICU usage. And so the good news is that our rates, they crept up a little bit last week, and we watched that carefully, and they crept right back down again this week. And so it's just that sort of low level of cases continuing to occur. When we look at what's going on with those cases, we do continue to see household transmission is the biggest factor around those. And so that's what it was before. Our healthcare worker numbers are, of course, down compared to where we had been previously, as we've gone through those outbreaks in long-term care homes and hospitals and whatnot. But the other thing is, just as we do this, it is a tremendous amount of work, and people are being very thoughtful. Organizations are being very thoughtful as we go forward. The government had produced a tremendous number of guidelines that people could follow. There are well over 60 sets of guidelines. And of course, we've provided some additional guidelines where we've had a lot of questions that we thought would be very helpful, or where we had some particular concerns. It is the inspections, and the childcare is a great example, where the inspections and decision to do all that work to go forward. And it is new ground for us all. And so we're thinking about issues and reflecting on them, sharing them across public health in Ontario, across people who are dealing with these issues, and coming up with answers. So it is, I'm really pleased that businesses, we've done as much as we can to get out of the way for businesses to reopen and not require a lot of inspections, except where we think it is really important to do so. And those businesses are still calling because they're being very thoughtful about what they're doing, and they want to make sure that they're doing the right thing. And so we're very glad to see that. So yeah, we just want to see those numbers continue to stay down. I've talked about this as sort of a training analogy. We spent 3 months training to remember all the things that we need to do. It seems that people are continuing to do those things we need to do. And as we move into stage 3, whenever that should happen, we'll continue to need to practice those things. And so to just have people continue on with that is very important.
Thanks so much. And Dr. Richardson, the province has said that it will work with local public health departments when it comes to stage 3. And so have you been working with the province yet? Do you have any idea of when stage 3 is coming, or have you made any recommendations to the province yet?
Yeah, well, we do work with them all the time. We meet with them twice a week, I should say, about COVID-19 and about what's going on, what we see, what they're doing. We're connecting as we go forward. There is a public health measures table that involves a representative from each area that works with the province on specific discussions around things, and we get updates where we can around those things, but nothing specific yet in terms of stage 3 and exactly when that will go forward.
Great. Thank you, Dr. Richardson. With that, Mr. Mayor, that's the end of our media questions for today. So I'll pass things back to you for some closing remarks.
Okay, thank you. And let me again thank our Cable 14 host and Bill Custers and their team for continuing to put this broadcast together. And thank everyone out there for dialing in through either Cable 14 live stream or otherwise by phone. And to McLean Media for ensuring that these availabilities run smoothly. And certainly looks like it's going to be a fantastic weekend. So I hope that you all look after one another. Continue to bear in mind that the virus is out there, and that you need to continue to take precautions, and you are. And so thank you for all that good work. That keeps our caseload down, and that's really the objective all the way around. And as we head towards possibly masking or other steps that will make it more comfortable and easier for people to function, especially in the business community, who have said on several occasions that it's particularly difficult for them with all the things that they have to do, that they also have to deal with masking issues. And so couldn't it be more consistent right across the board? I think that's the objective in terms of ensuring that we have a consistent policy for indoor spaces, no matter where you are, so that it's not a dog's breakfast of policies in different locations in different ways. So consistency is going to matter, and I think people will appreciate the consistent message as well. Continue to look after one another, make some good choices over the weekend in terms of enjoying your city, and have a fantastic and great weekend. We'll see you next week.